Cases of dangerous and potentially deadly fungal infection tripled during the pandemic. That's according to a new study from the CDC. Candida auris is a form of yeast. For a healthy person, it's usually not harmful, but for those with weakened immune systems, it can be deadly. More than half of the states have now reported cases of the drug-resistant fungus. Dr. Mati Hlatshwayo Davis joins me now. She is Director of Health for the city of St. Louis. Doctor, the CDC says this fungus spread at an alarming rate. But a lot of times it feels like there are alarming notices that come so frequently. Can you put these findings in context for us? Basically, how alarmed should we be?
Such a great question, because it is the CDC's job to tell us about threats as they arise. They wouldn't be doing their job otherwise. But as an infectious diseases doctor, I can tell you that the risk profile is very specific here. So yes, we are seeing an alarming rise in cases for this particular organism, but we have to put that in context. That's alarming for where it's not usually an organism we discuss, to now seeing some pretty notable outbreaks across the country, especially in healthcare settings. So appropriate to let us know, but no cause for anyone walking down the street to be alarmed.
And so, since you deal with those issues, balancing what's important in the health context, but also thinking about it in the public context, after 3 years of a pandemic, are we any better at, and you feel free to talk about the press in this context, are we any better at handling information that's important in one context, but a limited context, and information that's necessary and important for the public to know to make their health choices?
Listen, you're not going to get me in trouble, so I'm not going to speak badly about your colleagues in the press, right? What I will say is we know, and those of us in the healthcare field and public health field are the first to admit that messaging was not a strong point at the beginning of the pandemic. As an infectious diseases doctor, I would have been really upfront and transparent with people to say, infectious diseases are not monolithic. They're not static. I can't give you a set of recommendations that are the same today as they will be next week or even the week after. These are organisms that change day to day. Their genomic makeup make them, by definition, able to mutate and change, right? So that will mean that they will change over time. And quite frankly, we have to have learned coming out of a 3-year pandemic that people are exhausted. They're tired. Public trust has definitely taken a large hit because of the way that they interpreted some of the messaging, especially from large groups. And so it's a double whammy for someone like me as a local health director to figure out how to let people be aware of what is a priority without making them feel that at any given moment we're using scare tactics. So an easy way to look at this is this, okay? We focus so much, rightfully so, on COVID-19 for 3 years, but it's not like the rest of medicine just went away. And so it is natural that we will now see an uprising of a lot of other conditions that were either ignored or through natural selection are coming to the fore. That's normal. We're going to let you know about them as they arise. And a good communicator, which I like to think I'm one, will let you know who's at risk at any given moment.
Right. And in our part, we will try not to freak you out all the time, but hand the explanation over to experts like you, for which we're very grateful. Let me ask you this question. One of the things I read was it said that in part, this rise in this fungus might be the result of hygiene practices not being followed as best as possible because of the strain of the pandemic. Do you read it the same way? And is that what might be troubling, which is to say that best practices were overwhelmed by the pandemic and have those best practices come back?
Yeah, let's talk about this. Candida is not new. We've known about Candida for decades. This is a family within the fungus that we know about. What's newer is this particular strain, but we've still known about Candida auris for now since 2009. So this is not new. We have seen this strain in infectious diseases. I myself treated many patients during my fellowship and my time as a practicing physician, especially in high-risk groups like the immunocompromised, where it can be quite severe. So what is the new aspect of this is that we haven't seen it at quite these kinds of rates, number one. And number two, and most alarmingly, is we are seeing now these highly resistant strains, meaning we have a lot of fungal treatments for which can be effective against Candida auris, especially the echinocandins. But what we're seeing in this outbreak, and these outbreaks that we're seeing mostly in healthcare settings, is that they are not they do not respond to the typical antibiotics that we do. So it's this highly resistant strain that is of concern. Once again, the prevention methods that you discussed are exactly on point. You have to have really good infection prevention methods in your healthcare settings. Simple things like disinfecting, good hand hygiene, and hand washing methods go a long way.
Dr. Madi Hlatshwayo Davis, thank you so much. It's always a pleasure to have you on, and thank you for sorting us out.
Thank you. Great to be back.